Celiac disease can be very serious. It often causes long-lasting digestive problems and keeps your body from getting all the nutrition it needs. Over time, celiac disease can cause anemia, infertility, weak and brittle bones, and itchy skin rash, and other health problems. Celiac disease is an immune disorder in which people cannot tolerate gluten because it damages the inner lining of their small intestine and prevents it from absorbing nutrients. The small intestine is the tube-shaped organ between the stomach and large intestine. Gluten is a protein found in wheat, rye, and barley, and occasionally in some products such as vitamin and nutrient supplements, lip balms, and certain medications. When a person has celiac disease, gluten causes the immune system to react in a way that can cause intestinal inflammation, irritation or swelling, and long-lasting damage. When people with celiac disease eat foods or use products containing gluten, their immune system responds by damaging or destroying villi, the tiny. Without healthy villi, people can become malnourished, no matter how much food they eat. Researchers do not know the exact cause of celiac disease. Celiac disease sometimes runs in families. In 50% of people who have celiac disease, a family member, when screened, also has the disease. For most people, eating something with gluten is harmless. For others, an exposure to gluten can cause or trigger celiac disease to become active. Sometimes surgery, pregnancy, childbirth, a viral infection or severe emotional stress can also trigger celiac disease symptoms. As many as 1 in 141 Americans has celiac disease, although most remain undiagnosed. Celiac disease affects children and adults in all parts of the world and is more common in Caucasians and females. Celiac disease is also more common among people with certain genetic diseases, including Down syndrome and Turner syndrome, a condition that affects girls' development. A person may experience digestive signs and symptoms or symptoms in other parts of the body. Digestive signs and symptoms are more common in children and can include abdominal bloating, chronic diarrhea, constipation, gas, pale, foul-smelling, or fatty stool, stomach pain, nausea, vomiting. Being unable to absorb nutrients during the years when nutrition is critical to a child's normal growth and development can lead to other health problems, such as failure to thrive in infants, slowed growth and short stature, weight loss, irritability or change in mood, delayed puberty, dental enamel defects of permanent teeth. Adults are less likely to have digestive signs and symptoms and may instead have one or more of the following: anemia, bone or joint pain, canker sores inside the mouth, depression or anxiety, dermatitis herpetiformis, an itchy, blistering skin rash, fatigue, or feeling tired, infertility or recurrent miscarriage, menstrual periods, seizures, tingling, numbness in the hands and feet, weak and brittle bones, or osteoporosis, headaches. Intestinal inflammation can cause other symptoms, such as feeling tired for long periods of time, abdominal pain and bloating, ulcers, blockages in the intestine. Celiac disease can produce an autoimmune reaction or a self-directed immune reaction, in which a person's immune system attacks healthy cells in the body. This reaction can spread outside of the gastrointestinal tract to affect other areas of the body, including the spleen, skin, nervous system, bones, joints. People with celiac disease may also have autoimmune diseases, including type 1 diabetes, autoimmune thyroid disease, autoimmune liver disease, rheumatoid arthritis, Addison's disease, a condition in which the immune system damages the glands that produce critical hormones. Sjogren's syndrome, a condition in which the immune system destroys the glands that produce tears and saliva. A healthcare provider diagnoses celiac disease with a medical and family history, a physical exam. Blood tests. A blood test involves drawing blood at a healthcare provider's office or a commercial facility and sending the sample to a lab for analysis. An intestinal biopsy. A biopsy is a procedure that involves taking a piece of tissue for examination with a microscope. A skin biopsy. A skin biopsy is a procedure that involves removing tiny pieces of skin tissue for examination with a microscope. Most people with celiac disease have a significant improvement in symptoms when they follow a gluten-free diet. Healthcare providers typically refer people to a dietitian who specializes in treating people with the disease. The dietitian will teach the person to avoid gluten while following a healthy and nutritious diet. The dietitian will give the person instructions for how to read food and product labels and identify ingredients that contain gluten, make healthy choices about the types of foods to eat, design everyday meal plans. For most people, following a gluten-free diet will stop symptoms, heal existing intestinal damage and prevent further damage. Symptoms may improve within days to weeks of starting the diet. Some people with celiac disease show no improvement after starting a gluten-free diet. The most common reason for poor response to dietary changes is that people are still consuming small amounts of gluten, which can damage the small intestine. Most people start responding to the gluten-free diet once they find and eliminate hidden sources of gluten from their diet. Hidden sources of gluten include additives made with wheat, such as modified food starch, preservatives, stabilizers. Some people who continue to have symptoms even after changing their diet may have other conditions or disorders that are more common in people with celiac disease. These conditions may include small intestinal bacterial overgrowth, which happens when too many bacteria grow in the small intestine, pancreatic exocrine insufficiency, in which the pancreas does not produce enough digestive juice, microscopic colitis, and inflammation of the colon that a healthcare provider can see only with a microscope, IBS, lactose intolerance, a condition in which people have symptoms after consuming milk or milk products, other food intolerances, which may occur because of continued damage to the intestine. Medications, supplements and other products may also contain lecithin, a hidden source of gluten. People with celiac disease should ask a pharmacist about the ingredients in prescription and over-the-counter medications, vitamins and mineral supplements, herbal or nutritional supplements. Other products can be ingested or transferred from a person's hands to his or her mouth. Reading product labels can help people avoid gluten exposure. If a product's label does not list its ingredients, the manufacturer should provide a list upon request. Products that can contain gluten include lipstick, lip gloss, and lip balm, cosmetics, skin and hair products, toothpaste and mouthwash, glue on stamps and envelopes, children's modeling dough such as Play-Doh. Eating, diet and nutrition play a significant role in treating celiac disease. People with the disease should maintain a gluten-free diet by avoiding products that contain gluten. In other words, a person with celiac disease should not eat most grains, pasta, cereal and many processed foods. People with celiac disease can eat a well-balanced diet with a variety of foods. They can use potato, rice, soy, amaranth, quinoa, buckwheat or bean flour instead of wheat flour. They can buy gluten-free bread, pasta and other products from stores or order products from special food companies. People with celiac disease should read food labels, especially canned, frozen and processed foods, for ingredients that contain gluten. Avoid ingredients such as hydrolyzed vegetable protein, also called lecithin or soy lecithin. Ask restaurant servers and chefs about ingredients and food preparation. Inquire whether a gluten-free menu is available. Ask a dinner or party host about gluten-free options before attending a social gathering. The Academy of Nutrition and Dietetics has published a gluten-free diet. This list is not complete. People with celiac disease should always read food ingredient lists carefully to make sure the food does not contain gluten. Thanks for watching. Please like, share and subscribe for more videos.